Understanding the primary causes of the common flu. The common flu, also known as influenza, is a highly contagious viral infection that primarily affects the respiratory system. Understanding the causes of this widespread illness is crucial for prevention and treatment. Several factors contribute to the flu's spread and its recurrent nature, including the characteristics of the influenza virus, the way it mutates, and its modes of transmission. 1. Types of influenza viruses. Influenza viruses are categorized into 4 major types: A, B, C, and D. However, only influenza A and B viruses are responsible for the seasonal epidemics that occur each year. Influenza A is known for being the most variable and capable of infecting a wide range of hosts, including humans, birds, and other animals. This variability allows influenza A to cause pandemics when a novel strain develops. On the other hand, influenza B is typically limited to humans and is less likely to cause a pandemic, although it can still lead to serious outbreaks. Influenza C viruses cause mild respiratory illnesses and are generally not considered to be a major public health threat. Influenza D viruses, meanwhile, primarily affect cattle and have not been found to infect humans. Despite the lesser impact of influenza C and D, the ability of influenza A and B to rapidly mutate and spread remains a major concern in global health efforts. 2. Viral mutation and antigenic variation. One of the main reasons for the flu's persistence and recurring nature is its ability to mutate. Influenza viruses undergo frequent genetic changes through processes known as antigenic drift and antigenic shift. These processes allow the virus to alter its surface proteins, primarily hemagglutinin, HA, and neuraminidase, NA, which are essential for the virus to infect host cells and replicate. Antigenic drift refers to the small, continuous changes in the virus's genetic code that occur as it replicates. These small mutations can accumulate over time, leading to the development of new strains of the virus. This is why flu vaccines need to be updated each year to match the circulating strains. While antigenic drift results in relatively minor changes, these changes can still allow the virus to evade the immune system, causing people to become sick, even if they had the flu before or were vaccinated. Antigenic shift, on the other hand, is a more dramatic process that occurs when 2 or more different strains of influenza viruses infect a single host and exchange genetic material. This can result in the creation of a completely new influenza strain that can spread quickly through populations because few people, if any, will have immunity to it. Antigenic shift is responsible for the emergence of pandemic flu strains, such as the 2009 H1N1 swine flu pandemic. 3. Transmission of the flu virus. The flu virus spreads easily from person to person through droplets that are expelled when an infected individual coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or be inhaled into the lungs. Additionally, flu viruses can survive on surfaces for several hours, meaning that a person can become infected by touching a contaminated surface and then touching their face, especially the eyes, nose, or mouth. Another factor that aids the flu's transmission is its ability to be contagious even before symptoms appear. People infected with the flu can spread the virus to others up to 1 day before they themselves start showing symptoms. They remain contagious for about 5 to 7 days after becoming sick. Though young children, people with weakened immune systems, and those with severe illnesses may remain contagious for longer periods. 4. Environmental and seasonal factors. Seasonal flu is more common during the fall and winter months in temperate climates. Several factors contribute to this seasonal pattern, with cold weather being one of the primary drivers. Studies have shown that flu viruses are more stable in cold, dry air, allowing them to survive longer outside the human body. Additionally, People tend to spend more time indoors during colder months, which increases close contact with others and facilitates the spread of the virus. Moreover, lower humidity levels in winter may help the flu virus particles remain airborne for longer, increasing the chances of inhaling the virus. Conversely, in tropical regions, flu activity is more constant throughout the year, but may peak during the rainy season when people are also more likely to be in close contact with one another. 5. Populations at higher risk. While the flu can infect anyone, certain populations are more vulnerable to severe complications from the illness. These groups include young children. The immune systems of infants and young children are not fully developed, making them more susceptible to infections like the flu. Older adults. As people age, their immune response weakens, increasing their risk of contracting the flu and experiencing complications such as pneumonia or bronchitis. Pregnant women. Pregnancy causes changes in the immune system, heart, and lungs, which can increase the risk of severe illness from the flu. Additionally, the flu can pose risks to the unborn baby. Individuals with chronic health conditions, people with chronic illnesses such as asthma, diabetes, heart disease, or lung disease are more likely to develop severe complications from the flu. People with weakened immune systems, individuals undergoing chemotherapy, living with HIV/AIDS, or taking medications that suppress the immune system are at a higher risk of contracting and suffering complications from the flu. 6. Human behavior and social factors. Human behavior also plays a significant role in the spread of the flu. For instance, crowded places such as schools, offices, public transportation, and shopping centers provide ideal environments for the virus to spread. The practice of poor hand hygiene or not covering one's mouth when coughing or sneezing can further increase the risk of transmission. Another factor is healthcare access and awareness. In many cases, individuals may not seek medical care promptly, which can lead to delayed diagnosis and treatment, further spreading the virus. In some regions, especially in low-income areas, lack of access to healthcare services, vaccines, and antiviral medications can exacerbate the impact of flu outbreaks. 7. Co-infections and immune evasion. Flu viruses are particularly dangerous because of their ability to evade the immune system. When a person is exposed to the flu virus, their immune system produces antibodies to fight it off. However, because the flu virus changes so frequently, these antibodies may not recognize new strains of the virus, making it harder for the body to mount an effective immune response. In addition to immune evasion, co-infections with other viruses or bacteria can worsen flu symptoms. For example, a person who is already infected with a cold virus may have a weakened immune system, making it easier for the flu virus to take hold. In some cases, bacterial infections, such as pneumonia, can develop as a secondary complication of the flu, particularly in individuals with pre-existing respiratory conditions or weakened immune systems. How does the flu virus spread from person to person? Influenza, commonly referred to as the flu, spreads easily from one person to another, primarily through respiratory droplets. Understanding the mechanisms of how the flu virus transmits between individuals is essential for implementing effective preventive measures and controlling outbreaks. The transmission of the flu virus occurs through several pathways, each playing a role in its spread during flu seasons. 1. Airborne transmission via respiratory droplets. The most common method of flu transmission is through respiratory droplets that are expelled when an infected person talks, coughs, or sneezes. These droplets can contain millions of viral particles and are capable of traveling several feet in the air. When someone nearby inhales these droplets, the virus can enter their respiratory system, leading to infection. One of the challenges in controlling flu transmission is the sheer volume of droplets that are released with each cough or sneeze. A single sneeze can expel over 100,000 droplets into the air, and each droplet can carry thousands of virus particles. The larger droplets tend to settle quickly on surfaces, but the smaller ones, known as aerosols, can remain suspended in the air for longer periods. This makes airborne transmission particularly concerning in crowded or poorly ventilated spaces. Additionally, flu viruses can survive in the air for varying lengths of time depending on environmental conditions. In environments with lower humidity and cooler temperatures, which are common during flu season, the virus is more likely to remain viable in the air for extended periods, increasing the risk of inhalation by individuals nearby. 2. Transmission through direct contact. In addition to airborne transmission, the flu virus can spread through direct contact with an infected person. This occurs when an individual touches another person who is carrying the virus, such as through shaking hands, hugging, or other forms of physical interaction. If the virus is present on the infected person's hands or skin, it can be transferred to the other individual, who may then touch their face, particularly their mouth, nose, or eyes, allowing the virus to enter their body. Direct contact transmission is especially concerning in healthcare settings, schools, and daycare centers, where people may come into frequent close contact with one another. Healthcare workers, in particular, are at a higher risk of contracting the flu due to their frequent interactions with sick patients. For this reason, proper hand hygiene, the use of personal protective equipment, PPE, and minimizing unnecessary physical contact are essential strategies to reduce direct contact transmission. 3. Transmission through indirect contact with contaminated surfaces. Another significant route of flu transmission is through indirect contact with contaminated surfaces. The flu virus can survive on surfaces such as door handles, countertops, keyboards, and phones for several hours, and in some cases, up to 48 hours, depending on the surface type and environmental conditions. When an individual touches a contaminated surface and then touches their face, the virus can be transferred to their respiratory tract, leading to infection. The persistence of the virus on surfaces makes high-touch areas a common source of indirect transmission, particularly in environments where many people share common spaces. This includes offices, public transportation, schools, and retail stores. To mitigate this form of transmission, regular cleaning and disinfecting of frequently touched surfaces are critical. Additionally, promoting proper hand-washing techniques can significantly reduce the risk of indirect contact transmission. 4. Asymptomatic transmission. One of the most challenging aspects of controlling flu outbreaks is the potential for asymptomatic transmission. This occurs when an infected individual spreads the virus to others without showing any symptoms of the flu themselves. People with the flu can begin spreading the virus one day before symptoms appear and remain contagious for about 5 to 7 days after becoming sick. However, some people, particularly children or individuals with weakened immune systems, may spread the virus for a longer period. Asymptomatic individuals may unknowingly contribute to the spread of the flu because they continue with their regular activities, such as going to work, school, or social events, potentially exposing others to the virus. This is why public health experts emphasize the importance of widespread vaccination and preventive measures even for individuals who do not appear to be sick. 5. Transmission in high-risk environments. Certain environments are particularly conducive to the spread of the flu virus due to close contact between individuals and high levels of interaction. These high-risk environments include schools and daycare centers. Children are often in close quarters in schools and daycare settings, making it easier for the flu virus to spread. Additionally, younger children may not yet have developed strong hygiene habits, such as covering their mouths when coughing or sneezing, increasing the likelihood of transmission. Nursing homes and long-term care facilities. Older adults in nursing homes are at a higher risk of contracting the flu due to both their proximity to others and their weakened immune systems. These facilities often see rapid spread of the flu if preventive measures are not strictly followed. Healthcare settings. Hospitals, clinics, and doctors' offices are high-risk environments for flu transmission. Healthcare workers are frequently exposed to patients with the flu, and the virus can spread through both direct contact and contaminated surfaces in these settings. Workplaces. In office environments, employees often work in close proximity, share equipment, and interact in common areas like break rooms. If an employee comes to work while infected, they can easily spread the virus to their coworkers, especially if they touch shared surfaces or fail to follow proper hygiene protocols. 6. Role of hygiene and preventive measures in reducing transmission. Effective hygiene practices are crucial for reducing the transmission of the flu virus from person to person. One of the most important preventive measures is regular hand washing. Hands come into contact with many surfaces throughout the day, and washing them with soap and water for at least 20 seconds can significantly reduce the presence of flu viruses. When soap and water are not available, the use of alcohol-based hand sanitizers with at least 60% alcohol can also help. Covering coughs and sneezes with a tissue or the elbow can also prevent the release of droplets into the air. This simple practice helps limit the spread of the virus to others and reduces the likelihood of contaminating surfaces. Avoiding close contact with sick individuals is another key strategy to prevent flu transmission. People who are infected with the flu should stay home from work, school, and public places to prevent spreading the virus to others. Employers and schools should encourage sick individuals to stay home without penalizing them for their absence. 7. The importance of ventilation and environmental controls. Ventilation plays a significant role in preventing the spread of the flu virus, particularly in indoor environments where the virus can linger in the air. Ensuring that rooms are well ventilated with fresh air can help dilute the concentration of viral particles, reducing the risk of airborne transmission. In addition to ventilation, the use of air filtration systems and humidifiers can also help control the spread of the flu virus. Filters can trap viral particles, while humidifiers can add moisture to the air, making it more difficult for flu viruses to survive. 8. Seasonal factors and transmission patterns. The flu virus tends to spread more easily during colder months. Seasonal changes in temperature and humidity affect the transmission of the flu in several ways. In colder weather, people tend to spend more time indoors, where they are in closer contact with others. This increases the likelihood of coming into contact with an infected individual or touching a contaminated surface. Additionally, the flu virus survives better in dry, cold air, allowing it to remain viable in the environment for longer periods. As a result, the virus can linger in the air or on surfaces, increasing the risk of transmission. 9. Role of vaccination in preventing transmission. Vaccination is one of the most effective tools for reducing the spread of the flu virus. The flu vaccine works by stimulating the immune system to produce antibodies against the flu virus. These antibodies help the body recognize and fight off the virus if exposed to it. Although the vaccine does not guarantee complete immunity, it can reduce the severity of the illness and decrease the chances of transmission. Widespread vaccination is especially important in preventing community spread of the flu. When a large portion of the population is vaccinated, it creates herd immunity, which protects individuals who cannot receive the vaccine, such as those with certain medical conditions or allergies.